Welcome to yet another episode of Crack, Telling Reality and Creating Knowledge. And on today's episode, we're going to be talking about how high blood pressure is actually, let me just say, a pandemic in today's, in today's lifestyle. So on today's episode, I'm here with me. Here with me on today's episode is our doctor. She's here to help us understand more on how high blood pressure is actually a pandemic in our lifestyle today. And I have no other person than our doctor here who would like to introduce herself. Please, ma'am, can you kindly introduce yourself first?
Dr. Ngozi Kisarabo.
Oh, okay. Thank you so very much. You're welcome to today's session on Track.
Thank you for having me.
Thank you. And I am your humble host, Obadiah Moses, and I'll be taking you down the line to understand what it means to keep a healthy life away from high blood pressure. With our doctor here, she's going to explain more and give us more, to enlighten us more on how to live a healthy life when it comes to high blood pressure. Thank you. And before we go far, I would like our doctor to actually explain to us, ma'am. Please, can you explain to us what high blood pressure really means and how it affects the body?
I will start by saying what blood pressure is.
Oh, okay.
The heart pumps the blood,
Okay.
and it circulates around the body. The pressure with which that blood, exerts on the walls of the blood vessels, the arteries, that is blood pressure. And so, the body there has to be a certain blood pressure that with which the blood can flow and do its work effectively. Of course, you know what the blood does, carries oxygen and nutrients to different parts of the body. So now that blood movement is supposed to have a certain pressure, just like when water flows in a pipe. It needs a certain pressure to go normally. So when we talk of high blood pressure, we are talking of the pressure being more than normal. The pressure with which this blood being pumped by the heart is circulating around the body. Mm-hmm. That pressure, when it is too much for the blood vessel, exerting much stress and pressure on the blood vessel as it flows, the person has high blood pressure. In other words, the person has hypertension.
Oh, okay. Wow. All right. So, man, how does it actually affect the body? Because you said when it's high. So, which means when it's high, definitely will affect the functioning of the body. So, please, how does it?
Now, when this pressure that is exerting on the artery is too much, the artery is normally elastic, like an elastic tube, as this body is now, something is passing through it. Yes. At a normal flow, no problem. But when the force is exerting too much on the vessel, it can cause a lot of things. In any case, we have to know what the normal measurement is to say this is hypertension. Normal measurement is, worldwide is 120/80 millimeters of mercury. Blood pressure is measured. The unit of measurement is millimeters of mercury. Yes. So, the normal that is affected, although there are one or two things about this normal, but generally it is 120/80 millimeters of mercury. So we say somebody has hypertension when generally, again, for adults, we are talking about adults. When the reading is more than 140, is 140/90 or more millimeters of mercury. So that will we say the person has hypertension. And like I just explained, as the blood flows, if the pressure is too much on this vessel, it can cause the vessel to kink, especially the tiny blood vessels at the of the body, even the big ones, they can start getting kinked and swell up. You know, when you're blowing a balloon,
Yes.
at a stage, if it's too much,
Too much to
if
bust.
you just have, one swelling at one point or the other, maybe the weaker portions,
Mm.
and when that is too the stress is too much for that vessel, it can burst. And before that even happens, it gets thickened in order to try to withstand that force that is too much. It will get thickened, and because it's thickened, it will even further narrow the passage,
Okay.
the channel of blood movement. Because it's now narrower, it also has to, the heart has to pump with greater force for the blood to pass through these vessels to the end organs, to the organs that meet the blood supply. You see, how does it affect the body?
Yes, sir.
You now understand that the heart now have to work hard
Okay.
to be able to maintain
The blood.
the blood flow to the vessels.
Wow.
The blood vessels are also having problems. End organs like the brain with the tiny blood vessels all over. The vessels can burst or get clogged, and that portion of the brain affected can have kind of malfunctioning like memory loss, blood vision based on the retina of the eyes, and it could get to a stage where the brain will suffer a stroke. That is, the person now has what we call stroke. The blood vessel has gotten burst, in the brain and the function. Is something else.
Yes.
Person will now have paralysis of one point of one part of the body or the other. So these are the issues. The kidneys, in fact, virtually every part of the body can be affected. Blood pressure increased. The kidneys are also there and need to chronic kidney disease, because the kidney will be managing to survive this pressure and get sick itself too.
And the kidney is also like another powerhouse of the
Exactly.
body. Wow. So you have the high blood pressure is really, it's not just a small thickness. Something that is very big. It starts little, but it expands. Just as you can. Like they say, the example she gave when the balloon expands before it gets to a point where it's a big issue. So, ma, I'm also ask, how prevalent and let's say locally, how prevalent is it?
Hypertension is actually a disease of global concern. World compared about 26% worldwide of the population of adults suffer hypertension of one stage or the other. And what I've just said, 26% translates to about 1/10 of the population worldwide. But in Nigeria, record has it that about 31.2% of adults in Nigeria suffer hypertension. And worldwide, about 7 to 10 million deaths occur due to hypertension. Yes.
Wow. Wow. That's serious. 26%. That's what. But this is just for adults. Does high blood pressure also affect children? Like,
Yes.
so which means they also have their own.
Not very common amongst children, because you see, blood pressure also has to do with aging process. The blood vessels are getting thicker and more resistant. So the high blood pressure issue is more in adults, but children has to do some hypertension. Yes.
Okay. So, let me just ask, what are the root causes of is high blood pressure?
I will just classify it as primary and secondary. What we can say is the essential, because as we age, the blood vessels get thicker and more resistant to, to the movement of the blood inside, so that the heart has to also work a bit harder to get the blood passing through the vessels. So, in that case, we can say age is a risk factor to hypertension. And in some families, we have hypertension running in their genes, so it can be genetic. Yes. Yes. And it's more common in women than in men. Yes, women suffer more hypertension. Secondly, like I said, secondary, it can be secondary to some issues in the body. There are some medications that some persons will be taking that can cause hypertension. Yes, some drugs like steroids remain on pills, these contraceptive pills. Some who have hypertension, why they take these pills, and several other medications. Again, the kidney issues can also lead to hypertension. Just like hypertension can lead to kidney issues can also lead to hypertension.
Vice versa.
Yes. Malignancies, like some malignancies, some tumors that may not even be malignant, like thyroid disease, can cause, there are risk factors for hypertension. Adrenal gland, there's a gland on top of the kidney, that produces some kind of hormones. Those hormones, if they are produced in excess, they can also cause the blood pressure to rise and lead to hypertension. A number of issues, secondary stress, and in the case of women, some, when they are pregnant, their blood pressure rise, their blood pressure may rise and cause them to even convulse, eclampsia and all. So pregnancy is a risk factor too for hypertension. These secondary ones, when you remove the secondary causes, these causes, the hypertension, the blood pressure can come down. Like a woman that is pregnant and has hypertension, when she delivers, it will reasonably come down. Yes, reasonably. You may still be having hypertension, but not as still as it was. What issues do stress? Like we know, stress is real. Burnout is real. So
Stress from work,
stress from anything at all that can stress you, emotional, psychological, physical, can cause your blood pressure to rise. Even ill health. Even when you organize this are not okay.
True. When you're not paying salary. It can also cost.
Anything that can, cause you with emotional tension or whatever, can cause your blood pressure to rise. Bad news, something bad news. Yes. Heart diseases, so many. Cause hypertension. And like you don't just say somebody has hypertension by just measuring it once.
Okay.
You must have measured like 2 or more times. Having high reading, then you can see the person have hypertension. So it's not like you just came and your BP side just now and will label you hypertensive patients. No, I must have done it at least twice.
Wow.
It is consistently high when you can say you have hypertension.
Thank you so very much, man. Actually, the part I wanted to say something or probably ask little question about was when you said women go through hypertension more, or is it high blood pressure more than men? I was like, ah. But we are the men that go out to hustle for food, to stress, to worry about who, what they eat, how to pay rent, and all of those things. So I was thinking more men to get more of the high blood pressure than women. But when you explain about childbirth, I was like, okay, that one is also added. But why is it that women have it more than the men? Apart from just childbirth, let me just say, apart from, is there any other thing that adds to that?
Sex and gender is an issue. It's evidence based. Like you just said that during childbirth, I'm sure that is part of what's adding to the number that makes women to have this number. The hormonal, makeup of the woman, and in any case, it's also on record that it's more in the blacks and in countries with low income. Middle, the poor countries have more hypertension than the Western world. It's on record, yes.
Developing and all those developed countries. So I also want to ask,
And let me also add,
okay,
we just developing and poor countries. Environment can cause hypertension. Noisy places, places with polluted air and all that. Yes, they can add to the incidence of hypertension in such areas.
Okay. Wow. So basically, it means if you're staying at a place that is too noisy, probably, but because of the condition of, let's say, the country, you do not get to possibly select places to stay maybe based on work
Yeah, income.
or your income. The income determines where you select. Yes. Wow. Thank you so very much, man. So based on what we've discussed, why is it that high blood pressure is not tagged as a serial killer?
In silent killer.
Okay, sorry. Silent killer. I beg your pardon, sorry.
Usually, people generally don't pay much attention to their health. And somebody who have very high blood pressure and not know that the matter is serious, and not know that he or she even have hypertension, because we are not in the habit of going to check our blood pressure to see what it is. And even when we see, when the doctor says, oh, your BP is high, I say, I'll get it. And we try to use faith and not even go for checkup, not take our medications as prescribed. So we call hypertension a silent killer because one may be suffering from very serious hypertension without knowing until the person goes down. You just say, oh, we saw a certain man on the street yesterday. Today they say he had a stroke and he died. Or he just fell down and collapsed. Those are the issues. The serious matter. People don't know until some persons who know they have hypertension until it's too late. That's why we say it's a silent killer. Could be killing someone until the final straw will break the camel's back.
So you've just heard, viewers, it's good to go and do checkup at least once every month to know your health status. So once every month is okay, right? At least once every month, if you can be checking yourself up at least every month or at least twice every month, I think it will help you keep a, let's say, a balanced, healthy life, both at your workplace, at home, or wherever you might find yourself. Constant checkup helps you to know what is actually happening with your body. Just like you, let's say you take your bets, but you do not know that you have an injury in your hand, you just bet and just walk out. So with that checkup now, it helps you to always check all parts of your body to know where it's malfunctioning and where it's functioning well. So also, please, our viewers, for your questions and your contributions, you can reach us on this number via our WhatsApp. That's 081 693. That's, let me say it again, 081 693. Or you can also drop your messages on the YouTube comment section, and your messages will be attended to at the end of this section. Thank you very much. So, Maya, let me also ask, what are some of the things you can do to help you cope out that high blood pressure, like dieting, exercise, or what are those things you can do to help you boost your system?
Like when you know the cause of something, the problem is half solved. Now we have known a few causes of hypertension. Like we've said stress, so we avoid stress.
Okay.
We have said, of course, you can't avoid aging.
No.
Even we have what we call the positive is a good one.
Okay.
So the diet is important. It's something to modify, but that's what we call a dietary approach. It's not hypertension, slash the type of food you eat. Very oily foods like oils that are, there's the bad oil and the good one, the saturated fat. Those ones we try to avoid them. And then we eat sort of vegetable kind of things, fruits, lean meat, and also make sure you take a lot of water. Like I forgot to say, dehydration can also cause hypertension.
So then, you say you take a lot of water. I've not drunk since I came. So
Make sure you take water adequately to make sure the blood is thin, because if the blood is thick, you're dehydrated. It can cause clogging and hypertension. So getting well hydrated and good exercise, aerobics, things that will cause you to have good breathing, in and out, getting good oxygenation. Good.
like normal, you can in the morning you just wake up and just jog around your room, or just do sit up, or those ones they can also help to like.
The simple one everyone can do, breathing exercise.
Okay.
Deep breath in, out. Deep breath in,
I think that can be done anywhere, even at your work.
yes. When you say exercise, everybody cannot really do the same level of exercise. So it's graded.
Okay.
Then obesity, for those who are very fat, when somebody is very massive, of course, the heart also has to, do a lot of work to get blood around this massive. So the person is also prone to hypertension. There is a factor of obesity. So the person who is obese is advised to lose weight, dieting, exercise, and all that. Exercise is good. Dieting is good to lose weight. And if you're already a diagnosed hypertensive, please make sure you keep your appointments and take your medications.
Okay. You just had. There are some things you need to avoid at all costs for your own health. And she just mentioned some of them here. The last part she just mentioned, if you are a diagnosed hypertensive person, please, they say you should keep to your appointment, keep to whatever the doctor has told you to do. Just follow the instruction. I think that one will help keep your lifespan longer. So I think that on that you should take care of your health. That's just one of the major things that we need to keep hammering today. Take good care of your health.
So in fact, finding has shown that only about 1/5 of hypertensives take their medication seriously. It is not good. Dangerous.
That's very bad record. And the record is too poor. If only they would know how vital. They say health is wealth. If you're not healthy, how will you go out for your daily and how will you even be happy when you're not healthy? You feel bad. So you even feel weak. So you will always be laying down at home. Even small little malaria can just press me down. You used to feel like the whole world is crashing down on me. So imagine if you're having such kind of issues. So please take good care of your health. Take good care of your health. So what are the symptoms of high blood pressure? How can you identify high blood pressure?
Like I mentioned when you asked about hypertension being a silent killer,
Yes.
the person can just be going about without symptoms, and the blood pressure is hitting the yes. So, but on a general note, hypertension can manifest in a person through headaches,
Okay.
headaches, nose bleeding, blurry visions, the person will be easily tired, easy fatigability,
Mm.
and a number of things, vomiting, confusion. The person may even notice it for the first time through a stroke or heart attack, weakness, confusion, so many things. Maybe numbness of the fingers and toes. Those are just pointers to the fact that the person should go and do some checkup very fast. Influence,
Please look out for your health. Let it be your topmost priority. Let it be just something that let it be like your daily activity. Checking your health always. Thank you so
some will
much.
even have tightness in the chest pain,
Okay.
ways different people manifest conditions when they come.
So sometimes just okay. Since you said not everybody has their own different symptoms. So sometimes it might not just be you can have a regular headache, I can have a headache that's related to that.
Yes.
So your
And
suggestion is
you also have nothing, no complaint. Your head, as far as you are, you're fine, you're going about, not knowing that the person is a walking corpse.
that statement is scary. Working cops. No, I can see the reason why some videos you do watch online, you see someone just got provoked by somebody, and because then just raise a hand and just start the person falls and slumps. I think that relates to that. Probably the person is moving with such kind of illnesses, and he does not know, he's not aware of the things that are happening to him. So please always go for medical checkup at all costs. Because anyway, they say the word is enough for the wise. Yes, ma'am. All right. So, what are the consequences of an unmanaged? Just like you said, I know you said something like that. Can you still repeat for them? So I think what are the consequences of an unmanaged high blood pressure?
Consequences. Somebody that has hypertension may develop complications if not managed properly
Okay.
or not managed at all. Develop blurry vision, poor eyesight, they even have damaged retina and gets to the extent of partial or full blindness. heart failures because they have to do more work to cope with depression. Will lead to heart attack, whereby a portion of the heart, like we said, the passage of blood is hampered, and if the heart does not receive enough oxygenation, although it pumps the blood, it also needs to get its own oxygen to work. So if a portion does not get enough oxygen because of, clogged arteries and dead and all that, and that portion of the heart dies, the person will have pains and heart attack and they even go to death, kidney failures, then stroke in the brain that can lead to partial paralysis, or depending on the level of the stroke, and also death if the bleeding is too much in the brain, depending on where the stroke occurred. So the complications are a lot. And in any case, whatever complications we have, we also translate, like in a workspace like this. If peradventure somebody has that kind of, will the person come to work? And if the person has serious complications like kidney failures and all that, where the person will need to undergo dialysis and all that, the cost will now be more at the end of the day. Yes, when compared with early detection.
So there can also be full paralysis apart from partial, because you said when the person is faced with let's say with high blood pressure, they can have partial paralysis. So they can also be full paralysis.
Although that's not very common. Usually maybe one half of the body.
Okay. Wow. And you mentioned cost. I think that cost, I think there are some posts I've seen online where someone is going on that undergoing this kidney dialysis
Or even transplant.
and you hear them mentioning 12 million, 19 million, 20 million for operation. And I'm like, how will someone, where will I'm just imagining, where will I start raising money like that to do such kind of thing? So I think it's very good, as you said, early detection and managing it at that particular early age is very paramount. It's very paramount. So, but please, I would like to ask, what lifestyle changes can help prevent or manage high blood pressure? I think before you mentioned something like dieting,
Avoiding smoking and drinking,
okay,
living a healthy life, exercise, reduction in salt intake.
okay.
Maybe I didn't really stress on this.
But I think
It's something that we also need to take as important. Although these days we eat on those that there are salt as well. Evidence-based salt matters. Using salt intake for somebody with hypertension, or in fact anybody. Salt is important, but just the minimum, just the standard requirement that should not be exceeded. So for diet, you must reduce your salt, you must reduce your fatty meat, take lean meat, white meat, and fruits and vegetables, water, instead of all this tinned food and preservatives and all that. Those are the things to watch. Exercise, do your follow-up, take your medications, and above all, pray.
wow. Prayer is the key. It's the key to so many things. Okay. Wow. I did not even know that alcohol was it. I was just thinking maybe it's for maybe it affect diabetes or something. I didn't know it was part of that. Oh, I didn't know it was actually blood pressure main point. But she just said it, alcohol, smoking.
Like you also said, like you just mentioned that it's also a risk factor.
Wow.
In fact, diabetes and hypertension are friends. Okay. People who have diabetes are very likely to have high blood pressure.
Oh.
Yeah, they are sisters
Wow.
or brothers. They are cousins.
Just imagine. Salt, smoking. Guys, for the young, I think this message also goes for the young adults of nowadays, of this generation, let me just say. More especially the aspect of smoking and drinking has become like a norm. No, you should take care of your health because before you know it, you're growing old. Just like how doctor said here, that age, you cannot just find a way to skip it. You must get old. And as you're growing older, your body system gets weaker. And I think all this high blood pressure, even diabetes, everything will start coming in because of the reckless lifestyle, let's just say, that one is living. So, as you have just said, please, alcohol intake, please reduce it. Smoking, please reduce it.
Avoid it.
In fact, avoid. You just avoid completely. Avoid it. So, what you should be more concerned in is eating balanced diet food, vegetables, fruits. Those ones have more nutrients. So please, let's try and see how we can live a healthy life. Salt. I know of one of when I was studying in camp. One of when I went for my study, when we left camp, where we were staying, I have a roommate. When he puts lots of salt. And I say, when you're eating the literally, you feel like as if you're eating salt. As if you're eating salt. I'm like, say the Lord used to put plenty Maggi. And then you don't put because the salt is too much. You don't put plenty Maggi, but also don't put plenty salt. You still like you're leaving the salt and then you're leaving the what's the name of this thing? You're leaving the Maggi and then you're putting more salt and you're adding more harm to your health. I don't even advise him at some point. So he understood what I meant and he was able to reduce that. So I think on this note, we're going to the question and answer session. And we would like you to drop in your question so that our doctor here can attend to all of your questions. I think someone just dropped me a question on WhatsApp, and I'm going to read it now. And the person says, in a situation where one is feeling very hot internally as a result of too much thinking, can that lead to high blood pressure? If yes, how do one solve such problem?
You don't need to take all the questions and what you need.
No, we'll be reading them as just answer. Yes.
If somebody is thinking too much, what the person knows the cause. If you know the cause of something, it's hard to treat it. Yes. So now that the person knows as a result of too much drinking, it can cause high blood pressure. Yes. It's a kind of emotional and psychological stress within. It can cause high blood pressure. The truth is you can solve all your problems.
Very true.
Everybody you see has issues. There's nobody going about without issues. It's what you make of your own that matters. For those of us, who are spiritual, we do our best. Definitely do your best, physically, with your mental work and whatever. Then leave the rest for God. That's the way to go. Otherwise, the issues of life can weigh anybody down. Yeah, you have to determine how you take it. It's up to you. So don't think too much so that you can live to sort it out.
So family pressure, I think, also adds to like let's say a young man that is not married, sometimes family will be on their head. Do I marry you? Time or this and that. And they're like, you see your mates, they are married, they have 2 children. That one, would I call it, how would I put it? Would I say it's oppression, or like they make you feel, they make you to worry too much. So I think the thinking that also affects us. It also causes high blood pressure, right? Don't you worry too much about all my mommy will say this, my dad, if you go home. At some point, even making so many people not even travel home and to go and see their parents because they know they will ask them this question. So if I ask, what would be your advice in such kind of situation to both the person affected and the parents? Because I know this thing.
The answer is simple. We are not at any competition with anybody. Everybody is running a race at his own or her own pace. You married at 20, I married at 30, you married at 40, I married at 50. We are all on our lanes. So don't get yourself stressed out with that. And in any case, if you're marriageable age, do something about it and get married. But not to the extent that it will form an issue, shouldn't become a stressful point. No. Live a normal life and work towards it. That's my advice, my candidate.
So thank you so very much, man. What if there are people that want to marry? Let's say in such instance, and then the parents are hammering in such kind of situation.
Yeah, you already have a mindset. Like, what do you? You already have a mindset. So even if they worry from now till tomorrow, you've already advised yourself on the path you want to follow. Be yourself.
Wow. Thank you so very much, man. Thank you so very much for just advising. I think there is also another question here, and it says, what does it take to check your blood pressure in the hospital?
In our admin here, it's free. Don't
Okay.
take anything. Just come and check blood pressure. It's fit. We have equipment to check your blood pressure. And it's free. And in fact, it's one of the simplest things to check.
Okay. Wow. So what of people who are outside our vicinity?
People who are outside our vicinity.
Yes.
Yeah, hospitals and health centers, primary health centers all over the place. You can get your blood pressure checked. I don't think they take anything from one. Maybe in those health centers. I don't know. Then in some pharmacies, you also have suites to check. I think those ones are maybe not too sure because I have not done. But I think the charge is not to get it checked.
Okay.
But in the primary health centers, I don't think it should cost money.
So you've heard, my dear colleagues, what are you waiting for? The clinic is just open here. Go and check your blood pressure so that you avoid uncertainties of tomorrow. So that you have a healthy life. You know what you're doing. So that you know how to balance your life and your work life and your health. Please do well to check at the clinic. They say it's free of charge. You don't have to pay a dime. And for those who are outside, go to any health clinic, health center. They say it doesn't cost much. Let's say approximately around 1,500, around 500 to 1,000 naira. It's nothing much. You can, or you can even be less. So I think it's something you can be able to afford. If you can check it at least once a month, how much is 500 or 1,000? I cannot pay. Well, at the end of the day, if let's say you didn't check on time and then later you will be hospitalized because of this, you're going to pay more than this. Am I wrong? Of course, you're going to pay more than this. So please, let's try our best to live a healthy lifestyle, to keep our life in check, our health in check. So on this note, I would like our doctor, to just give us just the last note before we close. How can healthcare systems improve detection and treatment of high blood pressure? And what advice can you give to people who are not checked themselves and also are undergoing high blood pressure?
Healthcare systems can improve on the management of high blood pressure. For us here, let me start with my own lips.
Yes.
For us here, pre-employment medical check, very important. As you are employed, you come to the clinic, you have your baseline data, your health figures, what is your BMI, what is your weight, what is your height, what is your blood pressure, those basic things, we have them. And that will also help us to put a tab on certain individuals to say, please come next week so we can follow up. Come tomorrow. These are the drugs, so that we can know where we are starting with each person. Have a health record. Very important. Because for us here, yeah. And then for healthcare institutions outside here, when persons come to check their blood pressure, please, it should be free. To encourage people to check, because there isn't much to spend apart from maybe changing batteries on those digital ones, but the manual ones just use your energy to get it done. And I want to say, because as one gets older, the tendency for hypertension to become evident is there. So I want to advise every individual on that week, within that week of your birthday, please make it mandatory to have a health check. And then for an institution like this, in some places they do it, and I'm sure we can do it. Once in a year or once in 2 years, we have mandatory health check for all staff. You come to the clinic, we get everything done for you, your blood, taking for some analysis, chemistry, and all that. Then blood pressure, for that, one of the simplest to be done. So we get things done, and we have a healthier workforce.
Thank you.
The budget again for health.
Okay.
Because some of these drugs, they are cheap though, they are not very expensive. But even as they are cheap, as cheap as they are, many people are not able to afford these drugs. And our mentality, we also like cheap things, we also like free things. So if we can help by getting hypertension drugs, antihypertensives, staff can have students, everybody, whoever is having hypertension can have it on check, have your free drugs, that will be fine. That also means increasing the budgetary allocation for drugs. Thank you.
Wow. Thank you so very much, ma'am. We really appreciate you for coming on the show and being able to enlighten us and guide us through knowing how to take care of our health when it comes to high blood pressure. Thank you so very much. And I hope when next we have another program, we can invite you on health tips for you to come and guide us more on things about our health. Thank you so very much for coming.
Thank you for having me.
All right, and also to our viewers, thank you so very much for staying with us from the beginning of this session till the end. And I say thank you so very much, and may God continue to bless you all. I hope to see you again next time, same time, on track, telling reality and creating knowledge. I hope you gained some knowledge today. Thank you so very much. Once again, I am Obadiah Moses, your host for today. Thank you.